Dr. Garner, you are a specialized neurologist, allopathic doctor.
Yeah.
I always wonder and curious, how come you got interested in Ayurveda? What is it that inspired you?
I will tell you the story. It's, I think, quite interesting. Well, first I became a regular, normal, Western allopathic doctor, and I was working for some years on the intensive care ward of a neurologic intensive care in Munich. And there I saw what dramatic benefits patients had if they have had an acute problem, traffic accident, anything, and really wonderful healings. But I also saw that Western medicine could not really achieve good results in chronic diseases, like maybe diabetes, autoimmune diseases, and all these things. There only rheumatism, there only we had drugs to suppress symptoms, but we were not able to heal these things. So when I started my rehabilitation center in 1992, I was looking for alternative medicines which could help people with multiple sclerosis, diabetes, and all these chronic things. And 10 years later, in 2004, I got a phone call from a colleague which was here for a rheumatic problem, and besides the fact, she said they really could help me with school medicine.
This was the doctor who came here for rheumatic, and then she gave you a reference.
She gave me the hint, come here, because
I remember
here,
this doctor,
here you will find quite a lot of multiple sclerosis patients, which are coming from all over the world, from Canada, South Africa, America, Austria, wherever, and they are really happy with this Ayurvedic treatment. So I am very fond of India since the time when in 1979 I did my first medical practices in Kerala at a mission hospital. I admire the Indian culture and the Indian people. I took the chance and came here and did personally Panchakarma
2004.
treatment. 2004 it was, And besides that, I felt much better. I went home, I looked into the mirror, and I asked, well, nice looking boy, I really don't know him. My wife also was excited. She immediately also wanted to do some Ayurvedic treatment. And by that, we started then an Ayurvedic project for multiple sclerosis patients, which could not come to India because of handicap. And since then, we are doing this in Germany. However, what I want to share is about chronic diseases. When I was here first time in 2004, they presented me an 80-year-old lady. 80-year-old lady.
Wow.
With a huge number of files. She was suffering from diabetes for many, many years. And she told me 20 years ago with my diabetes, it was really bad. I was on insulin. I had many stays in hospitals. And my life was really not anymore very good. But then Dr. Naram started to treat me, and it took 10 years. After 10 years,
she took
diabetes,
the diabetic herbs from Ayushakti for 10 years.
For 10 years.
Wow.
But after these 10 years, the diabetes completely has gone.
Wow.
She can now eat anything with normal blood sugar. And for 10 years now, she is diabetes free. And she only was here because of some back pain.
Back pain, that's it.
That's it. And she was really a very alert looking lady. And I was really impressed because in Germany, I never have seen a long year diabetic patient being on insulin who could be cured. So I said there must be something different in the way of healing in Ayurveda, maybe also other traditions like Chinese medicine or yoga or something like this, than we are doing with our Western medicine, where I would also say Western medicine, of course, allopathic medicine, where it is necessary, and it also has its place. It is not only that you can say something is better or not, but for chronic diseases, I am really convinced that with tradition of Ayurveda you can achieve much more.
Yes.
The disadvantage is that people themselves, they have to do
A lot.
much.
They have to follow the
they
diet,
have to follow the
lifestyle,
diet,
take the herbs
lifestyle,
for long years, make a
being
detox.
patient.
But then their life is improved, they are getting free from the problem, so there is always a great advantage.
Right.
I always give example of a pressure cooker, that there is something boiling inside, but you don't want to hear this blast, so you put a lid, tight lid on the top, which is like allopathic medication, but this is still boiling, and at some point even that doesn't work and there's an explode. While Ayurveda, what it is doing, it is preventing the boiling itself. So then the blast is not happening.
Right.